Hi, here we'll talk about all the important points of phosphorus poisoning using this mnemonic phossy. The P here stands for phossy jaw. It can be seen in chronic phosphorus poisoning because of frequent inhalation of phosphorus fumes. So what happens here, if there is any presence of decayed tooth or missed tooth, there is already presence of super-A2 bacteria there, right? So these fumes will be acting on that area and can cause toothache, swelling of the jaw, loosening of teeth, necrosis of gums, and also sequestration of the bone, which will lead to osteomyelitis and necrosis of the lower jaw with foul-smelling pus discharge, right? Multiple sinuses discharging foul-smelling pus can be seen in the lower jaw. Coming to H, hemorrhages can be seen. So it is seen as a clinical feature, and also in the autopsy finding, you can see hemorrhages in the skin and mucous membranes. And O stands for oxidized in the body. What is oxidized in the body? This phosphorus is oxidized within the body. So what happens here, if there is any case of acute phosphorus poisoning and the person survives for the longer time, you cannot detect this phosphorus in the body of that person because it is already oxidized within the body. So phosphorus has this property of oxidizing within the body. Remember it, you cannot find it if the person lives for the longer time. Coming to S, you have to remember two things. One is second degree burns. If the phosphorus comes in contact with the skin, you can see second degree burns. And the other thing is shine. This phosphorus has luminescent properties, so even the vomitings and the fecus will be luminescent, right? Coming to the other is, you have to remember shock as a cause of death. Other cause of death can be liver failure, CNS damage, renal insufficiency, but also remember shock as a cause of death in many cases. The other S stands for smell. It has a garlic-like odor. And Y stands for yellow organs. So what happens in case of autopsy, you can see this organs like stomach, liver, heart, kidneys will be turning yellow. The mucosal membranes will be corroded, inflamed, and also turning yellow. So you can see yellow organs here, right? So this is about phossy. So to summarize, P stands for phossy jaw, seen in chronic phosphorus poisoning. There will be osteomyelitis and the necrosis of the lower jaw with foul-smelling pus discharge. H stands for hemorrhages, seen as a symptom and also seen in autopsy finding. O stands for oxidized in the body. So this phosphorus is oxidized within the body. If the person lives for the longer time, you cannot detect it in the body. S stands for second degree burns, shine, luminescence property. So even the vomitus and fecus will be luminescent. Coming to other S, again you have to remember two things. One is shock, it can be the cause of death in case of phosphorus poisoning, and the other S is smell. So this phosphorus has this garlic-like odor. To Y, yellow colored organs are seen. That is, the mucosal membranes of liver, heart, kidneys and stomach will turn yellow in the autopsy finding. So this is about it. Bye.